Welcome back, Focus Learners. Today, we are bringing you a brand new explainer tackling a condition that is incredibly complex, deeply misunderstood, but ultimately, when it's caught early, highly manageable. Today, we're demystifying rheumatoid arthritis, separating the myths from the actual medicine. We're going to break down exactly what happens when the body's defenses go rogue, and more importantly, how modern medicine is fighting back and, honestly, winning. Here is our roadmap for this explainer. 1. The autoimmune joint attack. 2. Recognizing symptoms and risks. 3. Diagnosing the disease. 4. The modern medical arsenal. 5. Physiotherapy and lifestyle management. And 6. A hopeful modern prognosis. Okay, so let's dive into this. At the very center of rheumatoid arthritis, or RA, is this fascinating biological mystery. Imagine your home's top-tier security system suddenly viewing you as the intruder. That is exactly what happens when your body's ultimate defense system, the immune system designed to protect you from viruses and bacteria, makes a devastating mistake and actually turns its weapons against you. It's a chronic, systemic inflammatory disease, and the battlefield it chooses, your joints. And get this, it doesn't strike equally. This autoimmune misfire most commonly develops between the ages of 30 and 60, and surprisingly, it's 2 to 3 times more common in women than in men. It's really a perfect storm, heavily influenced by environmental triggers like smoking and genetic predispositions, specifically a marker known as the HLA-DRB1 gene. Don't worry about the alphabet soup there, just know it's a genetic marker that can kind of set the stage for this whole condition. Let's transition into Section 1, the autoimmune joint attack. To really grasp how this biological betrayal begins, we first need to establish the baseline. A normal, healthy synovial joint, like your knee or your knuckle, is a beautifully engineered, well-lubricated machine. The ends of the bones are capped with smooth articular cartilage for shock absorption, and the whole capsule is lined by a really thin, delicate layer called the synovial membrane. This membrane produces just the right amount of fluid to keep everything gliding friction-free. It's peaceful, it works perfectly. But then, the attack unfolds in a very precise, destructive sequence. Step 1. Genetic and environmental triggers activate the immune system. Step 2, those confused immune cells infiltrate that peaceful synovial membrane we just talked about. Step 3 is where the chemical warfare starts. The immune cells release inflammatory cytokines, specifically things like tumor necrosis factor and interleukin-6. Think of these as the chemical artillery that fuels the fire. And finally, step 4, this rampant inflammation eventually leads to the physical destruction of the cartilage and bone. Because of all that chemical warfare, the delicate membrane actually thickens and mutates into this destructive tumor-like tissue called pannus. And the pannus doesn't just sit there, it goes on the offensive. It literally eats away at the surrounding cartilage and bone, causing those permanent joint deformities you might typically associate with severe, untreated RA. Let's move on to Section 2, recognizing symptoms and risks. As this microscopic battle builds into the physical fallout, the symptoms patients experience on a daily basis are incredibly grueling. There's persistent joint pain, swelling, and joints that literally feel warm to the touch. But the ultimate red flag, the classic hallmark that separates RA from typical aging, is morning stiffness lasting over an hour. If you wake up stiff but, loosen up in 10 minutes, that's generally normal wear and tear. If it takes more than 60 minutes to be able to make a fist or walk normally, that is a massive red flag. Another key indicator, it's usually symmetrical. So if your right wrist is under attack, your left wrist usually is too. Now, this brings us to a huge source of public confusion. Rheumatoid arthritis is absolutely not osteoarthritis. OA is the localized mechanical wear and tear of the cartilage that happens to a lot of us as we age. RA, on the other hand, is a systemic autoimmune disease. It's an inflammatory fire burning throughout the entire body, which is exactly why it can also cause severe fatigue, weight loss, and low-grade fevers. Because RA is systemic, it can actually attack organs outside the joints, like the lungs, the heart, and even the eyes. This brings us to emergency warning signs that demand immediate medical attention. Sudden severe chest pain, shortness of breath, or acute vision changes can indicate that the inflammation has actually spread to the lining of the heart, the lungs, or the blood vessels in the eyes. Furthermore, because a lot of RA medications suppress the immune system, a high fever or a really hot swollen joint could mean a severe, potentially life-threatening infection. All right, let's get into Section 3, diagnosing the disease. When doctors begin their diagnostic detective work, the absolute most important enemy they face is time. At 1 week, we have the initial immune activation. By 6 weeks, a patient might have that persistent morning stiffness we mentioned. But right there at the 3-month mark, that is the critical window of opportunity. If rheumatologists can catch the disease and start treatment within the first few months, they can often stop the pannus from forming and prevent bone erosions entirely. If you wait a year, that structural damage may already be permanent. So, to hit that 3-month window, doctors use a very specific diagnostic toolkit. They combine a thorough patient history and physical exam, where they are literally counting swollen and tender joints, with specific blood tests looking for rheumatoid factor and anti-CCP antibodies. You can think of those antibodies as essentially the chemical fingerprints left behind by the confused immune system. They also heavily rely on imaging. X-rays can show existing joint damage, sure, but advanced imaging like ultrasound and MRI are incredible tools because they can actually detect the early inflammation and synovitis way before the bone is destroyed. Which brings us to Section 4, the modern medical arsenal. The whole philosophy of modern rheumatology relies on this incredibly powerful concept, treat to target. In the past, doctors might have been satisfied if a patient just felt a little bit better. Well, not anymore. Treat to target is a strict clinical strategy where the ultimate goal is complete disease remission. The medical team will aggressively adjust medications until the inflammation is entirely halted, saving the joint architecture from destruction. To achieve that target, doctors really have 2 main categories of weapons. First, there's symptom relief, things like NSAIDs, like ibuprofen, or corticosteroids. These are basically temporary band-aids. They reduce pain and swelling, but they do not stop the underlying joint destruction. The real heavy hitters are disease-modifying anti-rheumatic drugs, or DMARDs. Conventional ones, like methotrexate, are often the first line of defense. But we also have these unbelievable targeted therapies like biologics and JAK inhibitors. Think of biologics and JAK inhibitors as smart bombs that specifically intercept those inflammatory cytokines, that chemical warfare we mentioned earlier, stopping the attack right in its tracks. Let's look at Section 5, Physiotherapy and Lifestyle Management. While medications are busy suppressing the immune system, physical and occupational therapy actively help patients reclaim their physical function. The goals here are absolutely vital: maintaining joint mobility, improving muscle strength to stabilize those joints, and learning energy conservation. Therapists teach joint protection techniques, like, for example, how to open a jar without straining inflamed finger joints, and they guide patients through progressive aerobic and resistance exercises. Listen, exercise does not worsen RA. In fact, controlled movement is completely essential for long-term function. And what about diet? Well, a Mediterranean-style menu that's rich in omega-3 fatty acids, fruits, and vegetables is highly recommended. It supports overall health, helps maintain a healthy weight to reduce stress on lower body joints, and it actually has natural anti-inflammatory properties. But while diet is a fantastic teammate, it is never a substitute for medical treatment. Diet alone cannot stop the aggressive biological attack of rheumatoid arthritis. You definitely still need the disease-modifying medications. Finally, we arrive at Section 6, a hopeful modern prognosis. If you take away just one thing from this entire explainer, it should be optimism. Decades ago, an RA diagnosis was often a guaranteed path to severe disability and permanent joint deformity. Today, that narrative has completely flipped. It's truly one of the greatest recent triumphs of modern medicine. Thanks to early diagnosis, those treat-to-target strategies we discussed, and the unbelievable advancements in biologic DMARDs, achieving clinical remission is a highly realistic goal for a lot of patients. With a dedicated rheumatology team, people with RA are living entirely active, functional, and deeply fulfilling lives. We've seen exactly how the immune system attacks, how the physical damage unfolds, and how modern medicine expertly counters it. But the single most powerful tool in this entire explainer is time. The damage RA causes in those first few months is completely irreversible. So I'll leave you with this. Knowing the critical importance of that 3-month window of opportunity, if you or loved one ever experience symmetrical joint pain and morning stiffness lasting over an hour, how will you advocate for your joint health? Don't wait. Demand answers, seek a specialist, and take control of your health. Thanks for learning with us today.